Dear viewers, today we are going to have one of our patient testimonial who have recently done the surgery from our hospital. So first I would like to talk with our doctor, Dr. Premstien. How are you, doctor, today?
I'm good. How are you, Ovi?
I'm great, Ajahn. Thank you. Ajahn, first I would like to know from you, could you please let us know your specialties?
I'm the orthopedic surgeon and had the subboard about the hip and knee reconstruction and the knee injury and the traumatology of the orthopedic.
So Ajahn, could you please discuss with us about the patient condition and why he need the surgery?
Okay, this case came from Bangkala. He really suffered from the left knee injury last 3 months ago. Okay, he had done the ACL reconstruction on the left knee 9 years ago. And last 3 months he had the injury to the left knee that's caused out the left knee injury and uncomfortable to move. He pain all the direction of the direction of movement and activities that we suffer. I think he had you have the information from your country, maybe this surgery.
Yes,
and he come here for get the information again and to decision to do something for his knee. First time by checking of the left knee, he limit motion of the left knee because pain or direction and some of the look of the muscle is smaller. It's hypertrophy of the muscle. It means he lack of or less use of the left knee or left legs for a long time. That's called the muscle is smaller. That's so good for this condition. That from the physical examination, I check. I think the ACL at the left knee it look black city or something not the normal. Okay, and he really pain when I test for the meniscus. I discussed with him about the problem about the ACL graft and the meniscus injury. Like this, in my opinion, he showed me the MRI. MRI showed the ACL is torn again, and the meniscus it had an injury. I told him you have only one choice because you're so young and need more activity. That's like this, you have only one choice of the treatment. Surgery. Oh, he done afraid. He really brave heart. Okay, made the decision to do the surgery. I do surgery for him. In tabulative, I check ACL graft. It look well. It's a good news. Alhamdulillah, it's good. The graft is good. It means no need for the reconstruction again. But the meniscus is torn, and not the simple torn. It's very complex torn. Thus, I do the partial meniscectomy and repair meniscus for him. Only one night you can move. The symptom it look very different before the operation.
That's great.
Okay, for this condition, for this patient, it's like that.
Okay. So Ajahn, how's the surgery went? After the surgery, what do you think? How is it now?
In my opinion, from the surgery, I think it's success. And really success did not mean only me. When I saw the patient, he can smile and he can tell me he feel better. It means success.
Okay. So now I will come to our patient. So Mr. Rahat, how are you today?
Yeah, I'm good. How are you?
I'm great, thank you. So could you please tell us, like, before you are having the operation, before coming to Vejthani.Hospital, what was your condition?
Actually, I was suffering for this meniscus injury, and I also suspected ACL injury for the last 3 months. So I was treated in my country, but the condition was not going well. So I tried to come to Bangkok.
Okay.
And after coming here, I heard about this Vejthani.Hospital. So I came here, I met with Dr. Premstien, and I was really happy about the procedure of the treatment, the diagnosis, and more importantly, he is very caring, and he could understand my problem at the very first sight. So I got confidence on this doctor, and I decided that okay, I will do the surgery under him. So after the surgery, I think it's 4 days before I had the surgery. So I'm already feeling the difference.
Wow,
now.
That's great.
I can walk with the crutches. The pains are decreasing day by day.
That's great. So I would like to ask you, like, what would you like to say about the service that you received at Vejthani.Hospital?
Oh, that's a good question. I think I didn't expect about the quality of service which the hospital is providing. From the entrance up to the doctor's chamber, the operation theater, in the cabin, it's just excellent. I can give 5-star about the service.
Good to know that.
And it's really good. I appreciate all of your effort, the nurses, the doctors, all the
Okay.
Staffs, everyone makes me very comfortable when I
Amazing.
come here.
So, what do you like to say about a doctor who had performed your surgery?
Okay, in Bangkok, before meeting Dr. Prem, I also met with two other doctors in two reputed hospitals. I'll not name
Yes.
their.
It's
But
easy.
when I met with Dr. Prem, I found he's very energetic. He can move the patients, and he can
Thank you.
very easily understand what the patient is suffering.
Okay.
So any patient can rely on him, I feel.
Okay. So, after the treatment, how do you feel?
I'm feeling a lot of better right now, and I wish all the best for Dr. Prem and his team, and also to the Vejthani.Hospital.
Thank you. So, I will get back to you, doctor, again.
Okay.
Like, doctor, do you have any advice for the viewers who is like watching this testimonial program?
After the operation, I will tell the patient, because you lack of the movement and really important for the young man.
Right.
The young man, it needs a healthy and stronger muscle.
Right.
That I will tell him, after operation, you don't only sitting and sleeping, must be move. You can move, but only one. Please don't full weight bearing for 6 weeks. It means to when you repair the meniscus, you're waiting for the healing process. Like that 6 weeks, after that you can full activities. But during this moment, you don't only sitting and sleeping. You must be exercise.
Right.
You can move your knee, you can move your hip, you can move your leg. Move it, exercise it. Make it come back alert and healthy.
Right.
Prepare for the movement. But for the other patient, the same. After operation, it's not only sitting and sleeping. When you decide for the operation, it means after operation you must get the better
Right.
result. After get the better result, it means quality of life. You must be got the better quality of life before do surgery.
Right.
It means you maybe come back do the same or the full activity, especially daily activity. Daily activity. It means must be done. Not only wait, late. Okay? And if the young patient like him, in my opinion, must be prepared for the future. Not only for 1 day, 10 days, or 10 years. I think for 50, 60, or 80 years in the future. Okay?
Thank you, doctor.
Welcome.
Thank you for your time.
Welcome.
Vejthani, victory for life.